Today, we are going to be looking at a fractured clavicle injury. The bone affected by this injury, as the name suggests, is the clavicle. It is also known as the collarbone and is located inferior to the neck. The clavicle is categorized as a long bone. Now, there are a few different types of fractures that can happen to the clavicle. First, we have a stress fracture. These are microcracks in the bone and can be difficult to detect. Then, we have a simple fracture. There is no separation of the bone, it is just a hairline fracture. Next, there is a compound fracture, where the bone breaks into separate pieces. If you notice, these are getting progressively worse. And finally, we have a comminuted fracture, where the bone shatters into many pieces. This injury mostly affects the clavicle bones and doesn't affect other muscles or ligaments or tendons. However, there are muscles and ligaments that can affect the injury itself, and these are the ones that originate and insert on the clavicle. And they are as follows: the sternohyoid, the pectoralis major, deltoid, sternocleidomastoid, subclavius, and trapezius. These muscles may become deforming forces on the clavicle with a fracture. Now, this picture here is really good to show these muscles and how they can be a deforming force. We can see the clavicle is pulled superiorly by the sternocleidomastoid. We can also see that the heavy weight of the arm pulls the segment of the clavicle inferiorly through the coracoclavicular ligaments. Now, these are just two examples of how the surrounding muscles and ligaments act as deforming forces. Now that we know a little more about fractured clavicles, let's look at how we can fracture it. The most common causes are falls, so any fall onto your shoulder or an outstretched hand. It could be a sports injury from any direct blow to the shoulder, vehicle trauma from any car, motorcycle, or bicycle accident, or even an injury at birth from passing through the birth canal. Bone union usually takes 3 to 6 weeks for children and 9 to 12 weeks for adults. This healing time varies depending on the severity of the fracture. Most collarbones heal without difficulty, although sometimes there can be complications. The jagged ends of a fractured clavicle may injure nearby nerves and blood vessels. There may be a lump in the bone as part of the healing process where the bone knits together, and because the clavicle is so superficial, that is, close to the surface of the body, it is quite obvious. There could be simply delayed healing if the bone is severely damaged, and poor union of the bones during healing can shorten the clavicle bone. Additionally, if the fracture involves the joints that connect the clavicle to the shoulder blade or breastbone, the risk of developing arthritis in that joint increases. Now, for recovery, physiotherapy is often recommended for healing. During the first 3 weeks after surgery, movement of the shoulder should be limited, so only exercises for the elbow, wrist, and hand are made to prevent stiffness while it's in the sling. The physiotherapist might recommend isometric exercises, which are mild resistance of the muscles without movement from the joint. After 3 weeks, some gentle movement will be added in, like shoulder external rotation and internal rotation, shoulder adduction and shoulder flexion, and shoulder extension and abduction. Then, after a few more weeks, as long as the healing process is moving along as it should, the intensity of the exercises will increase and resistance is added. So some of these exercises include resisted shoulder adduction and shoulder flexion, resisted shoulder extension, and latissimus dorsi strengthening, and then scaption exercises, which is simply the elevation and depression of the arms, as well as push-ups. And then hopefully you will be back to your normal self in a few months. Thank you for listening to my webinar on fractured clavicle injuries.